Hey guys, this is day number 2 post-op. I just got up maybe an hour ago, and my wife and daughters are taking great care of me. My wife has just been incredible. Other than the fact that she accidentally hit my arm yesterday, other than that, she's been absolutely amazing. Helping me with my meds, helping me with food, helping me to get up and down, helping me to get to the restroom. Like she's done everything, and I can't be more grateful for her. So, Dr. Nikkei Simone Wilkinson Fassett, I love you. You are without a question the best choice I ever made. I love you, and I appreciate you. But I'm still jammed up. I'm gonna be having this sling on for a minute. They're supposed to unwrap me like next week, but I don't think we're gonna make that appointment because I have the back surgery on. I thought it was Thursday, but it's actually Friday. So what's that? Uh, 9 days. 9 days from now. So I don't think we're gonna make the appointment where they were supposed to take this wrapping off and all of that. We're not gonna make it. I was supposed to start PT, but it's not gonna happen because I have this other bigger surgery happening. Where they're gonna make a small incision in the side of my butt slash hip slash waist area, and then quite literally use a hammer and a power drill to place and screw in 3 titanium plates um, across the SI joint. So right as your hip meets your spine, that area, they're going to put 3 titanium plates across there to immobilize the SI joint, which will, excuse me, hopefully stop the pain that's shooting down my butt, down my leg, into my feet, into my left foot. We did all the procedures, um, shots and nerve blocks and RFAs, which is a fancy term for burning the nerve to create scar tissue to slow down the pain signal. Nothing worked. And my doctor told me, like, there's nothing else we can do. We have to go and do a surgical consult. So we did the surgical consult, and that same day he was like, yeah, you definitely need surgery. So um, December 27th, um, they haven't told me what time yet. They should tell me, I think, next week on Monday or Tuesday. They'll tell me what time I'm supposed to come in. I'm going to be at Christiana Hospital. One of my closest friends and brothers, OJ, he's coming up from Maryland to just sit with me before the surgery and after the surgery, and to be there to support my wife with whatever she needs. And I can't thank him enough. He ain't got to do that. He ain't gonna have to do that. But that's just the kind of person he is. Like OJ's just a good guy. He's just a good dude, and he wants to come up and support. And I told that man, listen, if you ever need a liver, if you ever need a kidney, I got you. Like I'm going to get tested because that's how supportive he's been of me with virtually everything. So I'm definitely appreciative of him coming, and then my sister Sean is going to come to the hospital and again to support me and sit with me for a little bit, and then to support my wife as she sits there. Usually she sits there alone, so this time she won't be alone. She'll have 2 people there supporting her with whatever she needs. I'm sure she's gonna need something to drink, and one of them will rush off to go grab it so that she can stay. Um, so I'm really grateful for them. My sister Sean, she's making me a pan of vegetarian scallops. The way she make it is off the hook, and she would probably tell you that I'm a better cook than her, and I would tell you that she a better cook than me. Like it goes back and forth, but the scallops, her scallops, Nick, they hit every time. Them things always like are a masterpiece. So she's doing that for me. So I really appreciate, her and OJ for just their support and love and being willing to come and sit with me and to do something nice for my wife and do something nice for me. I really, 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 really appreciate them. So that's what's on the horizon. That's what's coming next week. But for right now, I'm just dealing with the arm, and it hurts. My dad was left-handed, so he taught me to do everything with my left hand. I even fight southpaw because that's just how I was trained. So like I instinctively sometimes will reach out or down with my left hand, this one, and man, the amount of pain has been incredible. But I'm about to get on off of here because medicine is starting to kick in, and I'm starting to feel like I look like this right now. Like I look like I'm up, but inside I feel like. So go ahead and call it a day for now. But this is day 2 post op. I don't know if you can see how much y'all can see, but my fingers are moving again. They're still just a little swollen. I can't like make a tight fist. You probably can't tell. See that? There's a hole there. I can't. That's as far as I can do it right now. But that's way better. That's an improvement. Obviously, I can wiggle my fingers. Even in this, the pinky is where I could feel the nerve damage from the ulnar nerve, and it feels much much better already. So I'm looking forward to seeing the PT folk. I call them professional torturers because that's what they do. They torture you. They do, but they know what they're doing, and they eventually they gonna get you right. They gonna get you right. So I appreciate them, and I can't wait to get started with them because I know that they're gonna stretch me and make me exercise and get me moving and get me back to 100% function, or at least as close to it as possible. The other thing is now that the anesthesia has started to really wear off, man, there's some spots like right now that's itching, and I can't take this ace bandage off to get to it. So I just gotta like just try my best through the ace bandage to just give it a little scratch. I wish I could like really scratch it, but I can't. So I'm just making do with what I can do. So continue to pray for your boy. I appreciate y'all. Everybody who's checked in on me, everybody who left a comment, everybody who thought about me, everybody who sent me a message or a text message or whatever. Thank all of you for your love and support. And I'll probably check in a little bit later. Peace.